Everybody, I'm Rachel. I'm the Chief Executive of the Patient Association, and I'm delighted to be with you today for us to have a conversation about the new Pharmacy First service. We're just letting people come in now, so we'll get started in a few minutes. But in the meantime, it'd be really nice to know who's here. So if you could go into the chat box, which Maya has done, thanks Maya, and just let us know, say hi and let us know who you are. And then we'll get started with some housekeeping rules in a couple of minutes. Great mix of people. It's fantastic. Thank you all for coming. Okay, I think we need to get started. We've got quite a lot of quite a long agenda to get through. So we'll go through housekeeping rules now and then get started. So again, thank you all for joining us. The webinar has been recorded. And then it'll be uploaded onto our website over the next few days so that it can be used and viewed again. So do check back if there's people that you feel haven't been able to attend today and would like to watch the webinar. If you can use the chat function, like I said, to say hello. But if you've got questions, can you move over to the other tab, which is the Q&A tab, because it's really hard to try and manage the questions in the chat because there's chat going on. We just want to make sure that we can get to all the questions. There's quite a lot of attendees today, so hopefully we'll get to all your questions, but if not, we'll have a look at them and make sure that we address them in some way. Closed captions have been enabled, and yeah, just be grateful if you just wouldn't take screenshots or photos of the panel. So the Patient Association are delighted to be hosting these webinars, and this is series 3 of webinars around the primary care team. And as an organisation, we work with thousands of patients every year through our membership, but through our information and guidance helpline, that's a national speakerphone helpline, and through our information resources on our website. And we talk to patients on a regular basis about their experiences, and we believe very much the patient partnership in the design and delivery of services and patient and communication and genuine two-way communications with patients is really, really important. So that's why we're really happy to be here and having this conversation. So if we close down the slides now, because the first thing I'm going to do, and David, thank you so much for joining us. David is the Chief Pharmaceutical Officer for England, and he's going to give us the strategic high-level approach and introduce Pharmacy First to us. So over to you, David.
Excellent. Thank you, Rachel. It's a real pleasure to be here. Thank you very much for the invitation to join. I'm really hoping we'll have an interesting conversation and address any questions that members of the audience might want to raise. So I'm a pharmacist, Chief Pharmaceutical Officer for England. I work in that job, I work from NHS England, and I'm head of profession and provide clinical leadership for about 75,000 pharmacists and pharmacy technicians who work in the NHS in England. I'm also the principal advisor on pharmacy and medicines use in the NHS, which means that my portfolio covers not only community pharmacy, but also pharmacy in hospitals and in general practices too. But the launch of Pharmacy First is a fantastic step forward. I'm delighted that the majority of community pharmacies have signed up to deliver this new service. It's going to be of great benefit, I think, to patients, communities, and all parts of the NHS by providing increased access to healthcare for patients, as well as greater professional satisfaction for pharmacists in community pharmacy, which I think is also an important element of the story. So developments in practice over the last few years mean that pharmacists and pharmacy teams are playing increasingly important clinical roles in the NHS as part of integrated healthcare. The pharmacist professional role has expanded significantly, and so Pharmacy First involves highly trained pharmacists at more than 9 in 10 pharmacies in England, assessing and treating patients for earache, impetigo, infected insect bites, shingles, sinusitis, sore throat, and uncomplicated urinary tract infections for women aged between 16 and 64 years. And this is all without the need for a GP appointment. The really great thing is that pharmacies are at the heart of local communities. They have private consultation rooms and can see people without always needing an appointment. I think the other thing to mention is that community pharmacists are highly trained professionals and experts in the use of medicines, as well as being highly trusted by their patients. All pharmacists train for 5 years in the use of medicines before they register, and they're also trained in clinically assessing and treating minor illnesses, as well as giving health and well-being advice to people to help them stay well. So Pharmacy First allows pharmacists to make the most of their knowledge and skills to provide NHS clinical services in the heart of local communities. And to ensure the safe and effective delivery of the services, pharmacists, including locums, are following national guidance based on 7 clinical pathways, a clinical protocol, and some specific guidance called patient group directions. All of this together provides robust pathways for pharmacists to follow and ensures that services and medicines are delivered in a safe and consistent manner, which the public and the NHS can trust. The 7 clinical pathways have been designed using the latest evidence and expertise in accordance with NICE guidelines. They've been informed by advice from GPs and other doctors, pharmacists, and specialists in areas like prescribing, children's health, allergy, and antimicrobial resistance. The pathways have been approved at the highest level by the senior medical leadership at NHS England. And using these clear pathways, antibiotics and antivirals will be offered to patients only if needed. Antibiotic dispensing data will be closely monitored by NHS England, and the National Institute for Health and Care Research has been commissioned to evaluate the service. I think it's really important to say that NHS England takes the threat of antimicrobial resistance seriously, and the NHS England Antimicrobial Resistance Programme Board has oversight of the delivery of Pharmacy First and the significant mitigations that have been put in place and designed into the service to avoid the development of antimicrobial resistance. Now, of course, a change of this magnitude doesn't happen overnight, but I'm confident pharmacists are and will do a great job with Pharmacy First. They're already trained and experienced in assessing how to treat minor illnesses, and NHS England has also provided new clinical examination skills training for community pharmacists. The training is designed to be accessed as part of a self-assessment framework, which builds on the fundamental requirements of the pharmacy regulators' standards for pharmacy professionals. Now, if all of this works as well as I anticipate, and patients use the new service, Pharmacy First could help to relieve some of the pressure on general practices, providing better access and addressing health inequalities. It's also an opportunity to build on the making every contact count approach, where pharmacy teams can help prevent ill health by identifying and addressing health concerns as they emerge. And so a key element in the success in realizing the full benefits for patients and the NHS will be building those effective and strong relationships between general practice teams and community pharmacies at local level. NHS England is working hard to promote that closer integration. So, Rachel, thank you again for the invitation to join. I hope that was of help, and I think I'm going to hand to Pallavi next.
You are. David, that was really helpful. Thank you so much. And Pallavi, you've appeared on screen, and I forgot to say at the beginning that you are having IT issues this morning. So I'm hoping you'll stay with us, and you may have to turn off your camera. So just to explain that to the audience. And Lindsey, I also forgot to say that you're actually working right now, so you may disappear off screen on us. So if you need to do some consultations, but if you do, we'll get you back on. So Pallavi, thank you so much. We can't hear you. Yeah, your volume doesn't seem to be working.
Better, can you hear me?
Yes, we can.
We can,
I
okay.
jinxed it. I'm sorry, I jinxed it.
So great that you can hear me. Hello, everyone, and thank you for inviting me to join the webinar today. Apologies for my IT. It looks like my internet's down, so I do apologise, but hopefully you can all hear me, and we'll join in those discussions a bit later on. So thank you, David, for that lovely introduction. Just so that everyone's aware, my name's Pallavi Dawda. I'm a pharmacist by background and work for NHS England, heading up the clinical strategy for community pharmacy. Alongside this role, I do work as a practicing pharmacist within a general practice setting and lead a team, a fairly large team within that. Outside of that, it's probably also worth mentioning that I'm a mum. I've got 2 children and have caring responsibilities for my elderly parents as well. So use the NHS and community pharmacy on a regular basis to help me with advice and support that I may well need in that space as well. So today I want to talk to you about Pharmacy First, give you some more information about it, as well as other services that are offered within local community pharmacies as well. As David's already mentioned, the successful launch of Pharmacy First is a fantastic step forward to recognise the skill sets of community pharmacy. Pharmacists are experts in the use of medicines and are qualified to manage and treat minor illnesses and see millions of patients on a day-to-day basis. For many illnesses, your local pharmacy can provide that clinical advice and medication to help you and the family feel much better. We know that people visit the GP for minor illnesses and that their pharmacist could help instead. So instead of booking that appointment with general practice, you can visit that pharmacy. Not only will that save you time and the need to try and get an appointment, you can walk into the pharmacy without that need of an appointment. All pharmacists are able to give you clinical advice and medicines if you need them. And if your condition is actually more serious, they do work very closely with general practice and other healthcare professionals to make sure that you are managed appropriately. The service will help release GP appointments for patients for those more complex needs. It's not that we're going to free them up and not have appointments anyway in general practice. What we found is that a recent survey has found that over 90% of people who sought advice and guidance from community pharmacy within the past year received really good advice. The new Pharmacy First service will build on the success of previous pharmacy services, including the community pharmacy consultation service, which connected patients that had minor illnesses or needed an urgent medicine supplied to that community pharmacy. And patients should continue to visit the pharmacy for minor illnesses, including any aches and pains, allergies, coughs and colds, and feel free to have that confidential clinical advice, thinking about asking their pharmacist first. The new element of the service, as David has mentioned, is the ability for pharmacists to manage common conditions through offering self-care and only if appropriate, a restricted set of NHS medicines to complete that episode of care without needing to visit the general practice. This service will allow pharmacists to play a bigger role in primary care and make sure that people are seen for the right service for their health condition first time. Other services your local pharmacy can also provide include the NHS blood pressure check service and supply of contraceptive pills, flu vaccinations, COVID vaccinations, as well as stopping smoking services and support when you're started on new medicines. Please do ask your pharmacist about these services. My colleagues Tunde and Lindsey are going to give you more information on the day-to-day running of the pharmacy services, but I wanted to provide a brief overview of what to expect during a pharmacist consultation. In a confidential consultation, in a consultation room, the pharmacist will ask you about your health in very much the same way as you would be asked by your GP. And with consent, the pharmacist will be able to access medical history, allergies, previous medication to help gather information that they really need as part of the consultation. For some of these conditions, the pharmacist may also perform examinations, such as looking into ears. At the end of the consultation, the pharmacist will then be able to recommend the best course of action for your individual needs. And then the process is in place that if they do need to send you somewhere else, that they have the ability to do that. If there are any concerns about about your health, they'll then be able to complete that consultation and manage you accordingly. Your pharmacist will always record the outcome of the consultation and send that back to the GP as well. I think I'll now hand over to Lindsey, who'll explain a little bit more about how this works in practice.
Thank you very much. So I'm Lindsey Fairbrother. I'm actually sitting in my consultation room now, which is why you can see a sink behind me, because I'm on duty as pharmacist today. I run my pharmacy in Derbyshire, in a large village in Derbyshire on the Derbyshire-Staffordshire borders. So just a bit of background following on from what David said. It's very much recognised that, you know, all GP practice and all primary care has a huge amount of winter pressures. So Pharmacy First really came about from the primary care recovery plan to look at how we could support the rest of primary care using the skills and the knowledge that we have. So it was implemented literally the 31st of January. So we've been running for virtually a month, with today being the leap year February, which is quite unusual. So in terms of what's happened, slight bit of background, then I'm going to use some real life examples, albeit we've only been operating for a month. We do have some great stories to tell you. So in terms of pharmacy in England, over 96% of pharmacies have signed up to provide the service. And to provide the service, obviously, we've undertaken all the training, utilised the patient group directives, got our staff on board, because it's very much a team effort in pharmacy. If the pharmacist is engaged looking after patients and more in the consultation room than before, then the rest of the pharmacy team, including the dispensing technicians, are stepping up, and they're being fantastic to support us to be able to spend more time with patients. But it's very much, I must stress, a team effort. So what else is happening? Pharmacy First, we've had it outlined. So we have got 7 conditions now that we can treat using patient group directive. Excuse me 1 second, I've just got a query. I do apologise, just 1 second.
I just said this is real life in practice.
I'm back, I'm sorry.
Okay.
Yeah, no, it was a palliative care prescription where they haven't put the quantity on, which means it's in a legal document. So I've just advised my dispenser to send it back to the surgery. Anyway, moving on from that. So yeah, we've got the 7 conditions that we can now treat, which already have been outlined. And it doesn't necessarily mean you are going to get an antibiotic. So for instance, sinusitis, if you present and you haven't had the condition for longer than 10 days, we advise self-care. More than 10 days, we then offer you a steroid nasal spray. And then it's only if you've used that and you find that that hasn't helped you that we would look at antibiotic use. So I must reassure you that we're not going to see excess antibiotic use. Just while I'm on that, so if I give you some real life examples, I would say the majority of the consultations we've done have been for children's ear, for sinusitis and for sore throat. But we also need to remember that Pharmacy First is a kind of umbrella term. There are actually 3 elements of Pharmacy First, and any of those 96 pharmacies signed up will also be providing not only the 7 conditions that can be treated using prescription-only medication, for which your normal prescription charge will apply, or if you're exempt, you'll be free. But also, as alluded to, we are doing the hypertension case finding. Sorry, another query about the controlled drug prescription. Okay, right, apologies for that. So also as part of that, we are doing hypertension case finding. We have been doing that for a little while now in pharmacy. When we discover a high blood pressure, we tend to then offer ambulatory machine that the patient can wear. They don't have to wear it during the night, it doesn't keep them awake. Now, in terms of that, just as an example, we do quite a few of those. We've probably done 3 ambulatories in the past month, 2 of whom were then referred on to the GP and are now taking medication. So you can see that's actually saving lives in a way, because it's reducing your stroke risk, etc., because we've managed to identify a patient that otherwise might not have been spotted. Just an example on the third part of the service. So Pharmacy First also incorporates, as explained, contraception in pharmacy. Now, a real life example of that, of which I was extremely pleased about. I had a young couple, very young couple, come in to see me for the morning after pill. So we sorted them out, made sure they were okay, made sure everything was safe for them. They weren't using contraception, so I actually asked them to book in on the Pharmacy First service to come and see me a week later. I gave them some literature, some websites they could read in between. They came back, and now that person is on contraception, which means, you know, they're safe, they can carry on, they don't need to worry, they don't need to panic about, you know, accessing services if something goes wrong. So that's absolutely fantastic. And I must say, as a pharmacist, I feel very proud to have been able to make that happen. In terms of what happens with the consultation, of course, we write up the consultation, we take clinical notes, and all that information goes back to your GP. So this is a very kind of round circle in that the GP will refer to us, and then we will provide the information back to the GP for the patient's notes. The important thing to note, and just maybe to manage expectations of patients, it is important that we have this service referred to us where possible from the GP, because if it's just a go down and see Lindsey down at the pharmacy, that none of the data will be captured. It's only if it comes as a formal referral that we can fill in the referral and send that back to the GP. Some patients can access some of the services as walk-ins, but we very much encourage referral mechanism to be used, because that almost gives us a feedback loop, which is in the interest of patient safety, to enable us to say what has happened to the patient. It also helps the doctor's practice. So if you can imagine, I've got a practice local to me. They have done, can you believe this, 200 Pharmacy First consultations since the 31st of January. And that's because the practice is totally on board on realising that almost the low acuity, kind of low-hanging fruit stuff, we need to utilise the skills of the pharmacist to help the patient and triage the patient. And that's opened up so many more appointments for the much more complex stuff that the GPs are rightly positioned to deal with. So that's terrific. But in terms of the pharmacy there, all those consultations have gone back now into the patient's notes. It helps the care navigators, because if the patient rings up for an appointment with the GP, we can see already that actually they've been down to the pharmacy, they've been asked to use a steroid nasal spray for 2 weeks. So having an appointment after 5 days, not really indicated. Get on, you know, keep going with the nasal spray, see how you get on. And then if you've still got problems, return to the pharmacy. So it's avoiding the kind of double appointment and the ineffective use of resource, really, which makes it so valuable. And I think, yeah, I could go on forever, but I will let Tunde tell his stories, because I really could tell you a lot more. I'm quite passionate about it. Thank you.
Okay. Good morning, everyone. Yeah, good morning, everyone. Sorry about this. I've got a bit of a sore throat today, but yes, I'll soldier on regardless. So my name is Tunde Sokoya, and I'm a community pharmacist. I run my own community pharmacy in Buckhurst Hill in Essex. I am a local pharmacy committee member, and I'm also a liaison for integration of pharmacy locally for 2 PCNs. I am also an independent pharmacist prescriber, so I've actually been prescribing privately for patients for the last 5 to 6 years. So I was one of the people on the focus group that highlighted the importance of getting these better relationships between community pharmacists and GP practices. So the launch of Pharmacy First has been very welcoming. So I can now see patients and not necessarily have to charge them, and can do it on the NHS. Basically, previously, what used to happen, we'd get patients come in on a Saturday and they would have a UTI, an uncomplicated UTI. But because we weren't allowed to provide antibiotics at that stage, it would mean I would have to refer them, because it's on a Saturday, to A&E. And they would go away and come back with what I would have predicted they would have got anyway. So Pharmacy First really has allowed us to utilize a lot more of the professional and clinical skills that we have as pharmacists. The feedback we're getting from patients is it has all been positive. The GP practices are embracing it and really making use of the pharmacy first. And this is fostering much more closer relationships between us and the GP practices. So I think, again, one of the key outcomes from this service will be to actually develop those relationships much closer. The customers, initially, they were a bit sort of weary. I want to see a GP. Why are you referring me to a pharmacist? But more and more now, people are actually looking forward. It might be because we do have a little bit extra time, I think. And I do think as pharmacists, again, we do provide a much more holistic approach when we are doing our consultations. And just to follow on from that, I'm going to just give you some real life examples using what I would say the #1 condition that is seen in primary care, which is UTIs. Now, 111, the #1 condition that they see is the UTI, and it's the same in GP practices. So to start off with, we would have had, again, this is in the last 4 weeks, we've had one lady come in, you know, she's got a UTI, well, suspected UTI. We go through the consultation, and based on her symptoms, it looks like she does not need antibiotics. So we would then tell her something over the counter for cystitis. But at the same time, the most important thing at this stage is that we safety net. And I think if you look at anything we do in pharmacy now, that is just so important. So we give them advice saying, look, if your symptoms change, please come back and see the pharmacist. And most importantly, again, I think the way we've improved access is that I can say to a patient, look, we've checked all your observations, we've done your blood pressure, we've done your heart rate, we've done, you know, all the necessary observations. And at this stage, it does not look like you have an infection that would need antibiotics. But look, if your symptoms change, please come back and see us. Now, we have the advantage that they can come in again without an appointment, as David alluded to earlier. They can come back and see us fairly quickly if needed be. And I would say we've done over 100 consultations since the start, and we've only had one person that's needed to come back. So, you know, it's really important. And the skills, I mean, most pharmacists are finding this really empowering to be able to use those skills. Now, I'll move on to a second case scenario, which is a lady comes in again, she's got the UTI, she's got the symptoms. Again, according to the PGD, there's 2 or 3 symptoms, which if they have, we can safely have a chat with them. Again, it's a sort of a decision taken between us and the patient. If it is the best outcome for them to go on antibiotics, then we will give them the antibiotics. Again, following up within 48 hours to find out how they've gone on. And also, again, safety netting to advise them that, especially with UTIs, if it's not got better within 48 hours, they need to come back and see us. The third case, which was a much more serious one, was where we had a lady come in on a Saturday. All her symptoms were just suggestive of a bit more serious condition. And she was immediately sent to hospital. And I've since found out that she's still in a hospital, and she's been in hospital for 2 weeks because she did have a UTI, but it had gone to her upper kidneys, and had developed into pyelonephritis, which could be potentially serious. So again, I think the beauty of this service is that patients are able to access a well-trained clinician to be able to get screened and seen much more quickly. You know, we're constantly sort of screening people for, you know, sepsis. We're screening people for things like even pneumonia and meningitis, and we're ruling out these things first before we then have that consultation with the patient, so that we can safely say all the very high risk conditions, we've ruled them out before we sit down and have that conversation. And as Lindsey has alluded to, it's not a panacea to say, oh, I'm going to the pharmacist to get an antibiotic. What really happens is you're going to the pharmacist to have a consultation, which will then decide if you do need antibiotics or not. But as Lindsey has said earlier on, I mean, I could go on and on and on. The only good thing about it is much more fulfilling for both staff and us pharmacists. You know, this is something I've been really waiting for and looking forward to. So, yeah, Thank you very much.
Tunde and Lindsey, thank you so much. And your passion for Pharmacy First is coming out strong. If people are picking that up. And Tunde, thank you, because what I also saw when you were talking there was, and Lindsey, was that real shared decision making between patients and the pharmacist, which obviously is what the patient association always want to hear. So I'm going to hand over to Leighton, and Leighton's going to introduce himself and tell us a bit more about him.
Thank you. Good morning. I'm Leighton Colegrave, and I'm one of 3 citizen reps on the Hertfordshire and West Essex ICB Primary Care Board. I've lived in Welwyn Garden City in Hertfordshire for the last 35 years, and I'm also the chair of PPG for one of the local GP practices. And as Rachel said, I'm here to give the patient viewpoint. And I'd like to thank the other panelists for the information they've given us so far. It's really useful to see the real life examples and the passion from the community pharmacists there as well. So thank you for that. Yeah, I think this is a really excellent and exciting initiative, and it's going to be using already available, highly trained and competent healthcare professionals in the community to reduce the pressure on our GP practices and also on the urgent and emergency care centres. I'm sure it would be more convenient for many people if they need healthcare advice and treatment. Lots of people live close to pharmacies, and as I understand it, and maybe we'll get clarification on this a bit later, is that you don't need an appointment if you've been referred either by 111 or your GP practice. I did think you could walk in, but let's talk about that a bit later as well. I know there's been a really large take-up of the scheme. I know in my area it's around about 93%, which is really fantastic. It will, I also spoke to some of the local pharmacies in my area, and they all said that they're in the scheme. And I got a little independent up the road that was really excellent, and he's really keen to be more involved in community healthcare like this. My family and myself, we already find that pharmacists are an excellent set of healthcare resources, and this applies to the small independent ones, both locally and in other parts of the country where I've got family, and also the big chains. And all the ones we've had experience of have been excellent. And I do remember during the pandemic, if we can go back that far, community pharmacies did an amazing job for everyone, staying open and providing really high quality service under the constraints we all had to follow. And I think this Pharmacy First initiative really builds on the commitment that pharmacists have got to the community. I know that you can get really excellent professional healthcare advice from pharmacies, but not everyone thinks about using them. Some of my family members have gone to pharmacies with different minor issues, and the advice and recommendations has always been excellent. The sort of examples I can think of are like minor eye problems and insect stings, infected cuts and sprains. And if it has been something more serious, and I know it has in the case of some of my friends and family, then the pharmacist has quickly advised them to see someone more appropriate and helped them or told them how they should do this, which is really, really great, I think. One of the things I often hear, and I see it a lot on social media as well, is lots of people still think they need to see a GP about just about everything medical concerning them. And I know this scheme is not about replacing GPs, but I really think we need to get the message across that community pharmacies are a fantastic and excellent first port of call for lots of minor medical issues, not just these 7, and for health-related questions in general. And this will be really, it's going to be much quicker and simpler and more convenient. And it will give people the same end result, if not slightly better, than using their own GP practice, especially from a timing point of view. I know that lots of pharmacies already offer lots of services like vaccinations and blood pressure testing, which has already been mentioned by Lindsey and others, cholesterol testing, contraceptive advice, and more general advice. Well, I think this extension to these 7 specific conditions where prescribing is permitted if necessary is a really great addition. And perhaps we'll see it extended to more conditions over time, which is a good success. So just to end, I'd like to reiterate that I think this is a really fantastic initiative from a patient perspective, and it's using well-qualified healthcare professionals who already deal directly with the public. And so this should improve access to primary care. And if the public are made aware of this scheme and buy into visiting the pharmacies for these issues and other medical issues and advice, well, I'm sure it will be a really great benefit to us. So yeah, I do have some questions, but thank you for the opportunity for letting me speak.
Leighton, thank you so much, and we're delighted you're here. And you do have some questions, and I'll come to you. I'll come back to you in 1 second for those questions. But one of the things that's coming up, Lindsey and Tunde, well, I don't know who's going to answer this. It's the referral versus the walk-in, because there seems to be a few questions of clarity in the chat, and Leighton, you brought it up there as well. So I'd just like to address that and come back to you then, Leighton, for some questions.
I'll just explain that a bit further. So the service does allow for walk-ins as well as for referrals, but very much like Tunde says, we want to be working as part of the healthcare team. So what we want to see is that the triage done by the practice receptionist includes the pharmacy first scheme, such that if somebody is presenting with a minor ailment that can be dealt with through that service, that it is referred. Now, when a referral is received by the pharmacy, we get a message with the patient's details and their contact number. The patient can contact the pharmacy themselves and explain that they've been referred by the GP practice, although we are alerted to look out for referrals that come in. So if we don't hear from the patient, we actually contact them. Obviously not immediately. Patients have got to realise that we are actually doing a day job, but we do get to those as soon as possible. Now, the term kind of walk-in versus referral, I think Leighton was expressing about how, you know, it's great, you don't need to have an appointment. There will be some changes to the way both pharmacy and patients have to behave for pharmacy. So if you imagine, if you're going to get about 10 pharmacy first referrals in a day, you actually do need to give people time slots. You need to ask people to come at 4 o'clock or 3:30 or 2 o'clock. Because if you had all 10 people turning up at once, people would be very dissatisfied with the service. They'd be waiting. You know, they would not have their expectations met. So certainly the way that we do things, which is a change for pharmacy, is of course we'll see people that walk in. Of course we'll give advice, you know, over the counter for anything that's not included in the scheme. But when there's a referral, what we try to do is ask people to come in at a certain time. So we'll speak to them on the telephone and then we'll tell them what time we'd like them to come in, because that allows us to block out on the diary other things that might be occurring. Because as Tunde, you know, I'm an independent prescriber as well. So I run a travel clinic and I can't possibly have somebody coming in for a yellow fever jab at the same time as having a sore throat consultation from Pharmacy First. So it's a bit of a shift of how we have to operate, but we also need your support to kind of educate patients who might expect to just get everything by walking in. Thank you.
Thanks, Lindsey. And I think one of the questions that's coming up around the training of receptionists to be able to do this role, but we're not going to be able to cover that here. But in our first webinar, looking at the changes in primary care, we did look at the emerging and changing role of the reception. And in there, it was addressed about the training that receptionists were getting to be able to do this. David, I think you were trying to come in, were you?
Rachel, thank you. Yeah, that's you were really good on my body language while I was looking for the right button to press there. I mean, Lindsey's largely sort of picked it up, really. I think the main message for everybody is you can access the service by walking into the pharmacy, as Lindsey said, or you can access it by being referred from the general practice if that's where you've contacted first. So, you know, both things are true. Pharmacists have access to something called the National Care Record, used to be called the Summary Care Record. And whatever route you use, pharmacists will be able to look at that information. But a really important part of the service is it's a consultation. You know, in that consultation room, where it's possible to kind of share information, reach joint decisions, as you said, Rachel. And so the sort of synthesis of that information and anything that you can see in the National Care Record builds the picture to come to a sort of appropriate and shared decision about what to do. And whatever route you use to access the service, a message will go from the pharmacy back to the GP, your GP surgery, so that that information loop is closed and all parties know what's happened. I think Pallavi's answered a question in the Q&A bit, which pointed to the fact that we're trying to go even further with the digital integration too. that's that's kind of rolling as we speak almost, but that will then make the sharing of information even more straightforward than it is now. So you know, positive steps in all directions, but essentially you get the same quality of service however you present for it.
Brilliant, thank you, David. We wrote our manifesto for patients with patients around the general election coming up, and one of the things in there was about genuine two-way communications. And actually, one of the calls we're asking for is that the use of that summary care record be more consistent, because you know, you just pointed out the real importance. So I'm not going to put you on the spot as Chief Pharmaceutical Officer, but you know, whoever you can talk to back there in head office, just tell them that that's what we're looking for. Now, I'm going to hand over Leighton. You were going to ask a question around advertising and how do we get people to know about this?
Yes, thank you. Yeah, and now this is launched, I think it's really important that everybody gets to hear about it with some kind of national publicity campaign. And my question really was quite simple, that the scheme launched on the 31st of January, but I don't think I've seen very much or any widespread publicity about it. Is that the case? And is there a major publicity campaign planned for the near future, please?
I can come in on that one. So yes, Leighton, there is a publicity campaign that went live earlier this last week. So you will be able to see that on demand TV. There's some campaign materials available. So pharmacists will have posters and things that they'll be able to put up. So you will start to see some of that coming through in the near future.
Fantastic, thank you. And the other thing, Pallavi, that's coming up in the chat would be and maybe it exists, but maybe we can send it out to people when we're sending out feedback forms, if it does exist. You know, the role of the patient participation group within GPs to work in partnership with patients and the practice and local health watchers. Is there any kind of leaflets, frequently asked questions that we could circulate so that the PPG and local health watchers could make sure that they're raising the profile of it as well?
Yeah, so we are linking in with Healthwatch nationally. We are communicating with all kind of stakeholders in that space. There are some materials available for general practice for patients to address those bits. We're working really closely with our pharmacy teams within general practice as well, so that they're able to work with community pharmacy with their PPG groups, because they do attend those groups as well. So to start to make people aware of the service and let people know that this is happening or can be a thing in itself. So yes, lots of work is going on in that space, and we can absolutely share you links with those materials.
Brilliant. Pallavi, we should talk later and see what our website, the Patient Association website, can do to support that information as well, because we get thousands upon thousands of downloads, which is fabulous. And so maybe Maya can have a chat with you about that. Leighton, you put a lot of prep into this, and you did a lot of questions. I think a lot of them were answered through the presentation, but I'm just going to come back to you to check what other questions. Do you have another question you'd like to ask of the panel?
Yeah, I do think quite a few of those questions that I wrote down earlier have been answered. But yeah, I have got one. David just alluded to it, digital integration. But I first heard about Pharmacy First through my work on the local primary care board. And in the pre-launch information, I saw that it actually said the start date is dependent on required IT systems being in place. And I understand that these IT system changes were to allow a sort of a seamless digital integration between pharmacies and GB practices, so that there's minimal manual work needed to update a patient records. And I think it was actually going to update a patient's record almost automatically with details of the consultation they'd had in Pharmacy First. And I heard that those changes were not quite ready yet, but the launch went ahead anyway. So I just wanted to know that, is that correct? Is there still further IT work that needed to be done so that digital integration is working properly? And is that having any impact on the service now?
So I come in on that one. So lots on that, Leighton. I think it's worth mentioning that we've had the community pharmacy consultation service in place since 2019, and general practice are used to seeing referrals by other clinicians in other healthcare settings coming back into their records. So this includes A&E settings, urgent treatment centres, and community pharmacy as part of like the community pharmacy consultation service, the blood pressure check service already. And these go through as NHS mail into their system. That's no different for Pharmacy First currently. What we have committed to as part of the primary care access recovery plan was the commitment to make that digital integration really smooth and really at the forefront. So what we have done is use the community pharmacy. Pharmacists will do a consultation record on that they will fill out through that consultation. That is the minimum we would need to have ready for the service to go live, and that is ready. So all pharmacists will have a structure that they will complete so that we know that all patients are getting the same consultation questions being asked in that space. So that has gone live. In the background, what that'll do is that'll go back into general practice records as an NHS mail, as it's been doing for the community pharmacy consultation service. But within the next few weeks, what will happen is that message will now go back as a structured message into the GP record. So instead of it going through NHS mail, where the reception team or like the clinicians will then have to put back into the records, this will go as a click of a button. They can just accept it into the records. That work is ongoing, and as I say, hopefully in place over the next few weeks. We're also working on giving pharmacists access to patient records on above and beyond what is available through the national care records as well. And again, that bit we'll work through. We're also working on allowing that digital functionality between general practice and community pharmacy to make those referrals really smooth and really integrated as well. So those works are coming into place, and we've got a big team working on this behind the scenes to try and get that into place to make what we have got even better. At the moment, it doesn't mean that the service has gone live with being suboptimal or anything like that. It means that we've just followed business as usual processes to make the service live, to give the benefit to patients for the service. It is worth remembering we've had over 30,000 clinical pathway consultations since the service launched, and actually that's 30,000 patients that have been managed and supported through that service as well. So we're working on that to try and make it even better now.
Fantastic, thank you. I have a question in my head as you were speaking, and then it just disappeared completely from my head. The question around people with multiple conditions is in the Q&A, and if somebody on multiple other drugs uses Pharmacy First, is there a risk of contradictions with the drugs they're already on? How is that managed? Lindsey, can you come in on that?
Sure. So as David explained, pharmacists do a 5-year degree. So we're kind of the most focused on medicine safety of any profession, really. And having access to the National Care Record and in the future GP Connect, we do check and we do speak to the patients and ask them what other medications they're on. And amongst the patient group directives, there are a number of exclusions. So there are some defined medications or treatments that you might be on that mean that you will not be able to be treated by us. And that's why we'll have a referral loop back to the GP. But to reassure you on that front, of the consultations carried out so far, 9 out of 10 have been handled and successfully treated in pharmacy. Only 1 out of 10 has got to go back to the GP because there are other serious underlying conditions. So it's not kind of generating extra work. It is, as you say, saving those 30,000 consultations so far, which is just amazing. But yes, be assured, you're talking to a pharmacist. That's what we do for a living. That's our bread and butter. And we would, urge any patient to express any concerns about any of their medications, whether it's side effects or interactions. And we will always check that out for them and give them an accurate answer.
And then, you know, absolutely, and when my kids were small, and I would always go into my pharmacy, and I will still go into my pharmacy. And I don't know how I ended up being somebody who would always go to the pharmacy before I dream of going near a GP. It just was the way, and the relationship I had with the pharmacist with small kids. And you know, sometimes it was like you need to bring them to the GP, other times it was they could help me. But you talk about, so I absolutely get the training and the professionalism of the pharmacy teams. But that it doesn't stop just with training. It doesn't stop just with your qualification. And I am sure that there is kind of standards that you need to keep up to with training and professional development.
Absolutely right. We have criteria just like GPs too, as to undertake a certain number of hours of extra training. But, you know, if you can imagine, the Pharmacy First has been a whole heap of extra training for a lot of people. Myself and Tunde are fortunate. We're independent prescribers, so we have more kind of background training than some pharmacists. Although for another webinar, you know, bear in mind that from 2026, all pharmacy graduates will come out as prescribers. So I see the Pharmacy First as a kind of foundation stone as to how we're going to utilise prescribers in the future, which is hugely exciting. But you're right, we don't just kind of leave it there and say, oh, we know all that, we're not going to do the training. You know, we have had to go through all these patient group directives, of which there are 23 for the 7 conditions. And those that haven't got previous experience of clinical examination have given up Sundays to go and be trained. You know, bear in mind, pharmacists don't get protected learning time. So they've done all this of their own bat, which is highly commendable and absolutely fantastic, because it gives that access that the patient needs.
Brilliant. Thank you. There's some fabulous ideas about how you can communicate the Pharmacy First. So Hannah and team, I hope you're looking here about, you know, supermarkets, high streets, to really get the message across about the role of the pharmacy and the important role of pharmacy in the whole primary care first team. Leighton, we are running out of time, which I always happens. Do you have another question you want to ask?
Yes, I do. I wonder if I could ask questions surrounding people who may have more difficulty in accessing healthcare, such as those with disabilities, including sensory impairment, like the deaf and the blind, and also those with learning disabilities and neurodiverse conditions. Can all those different people with those different levels of difficulty in getting access make use of Pharmacy First? And has there been any special provision or training been done or made for those groups of people? I'm sorry, it's a bit of a long question, but I think it's quite an important one.
David, do you want to come in on that? Or Pallavi?
Yeah, I can certainly comment from a kind of principle position, and it's a really good question, Leighton. And I think the principle is that we're trying to improve access through these services. And so the sort of opening position would be, yes, you know, the service is there for people who need it. And I'm particularly interested in how something like Pharmacy First can start to address health inequality because of that community-based aspect element of it. And it's something I've asked the evaluation team to think about seriously in the evaluation, is can we actually demonstrate that this addresses inequality? I think the more general point is that pharmacists work hard with their communities to meet individual need in any case, and so that would transfer into this service as well, that general principle of supporting people. The only sort of boundaries, if you like, on what we can do through Pharmacy First, as Lindsey said, and I think Tunde mentioned it as well, in the patient group directions, there are inclusion and exclusion criteria that are designed so that people are not sort of inappropriately exposed to treatment through the service. You know, so it puts some boundaries on, and there are some age limits. I think people in the audience have commented about the different ages that are eligible for parts of the service. And whilst that might look complicated, in fact, the reason there's such a broad range was to make it as accessible as possible, because we could have said, well, it's only people between 5 and 65, for example. But in fact, in the pathway groups, there was a lot of emphasis on, no, you can treat younger people than this, and they will benefit from the service. So that's why there's an age range. I think I saw a question asking, why is UTI only for women and only between 16 and 64? And, you know, the reasons for that are if you get a presentation outside of those age ranges or in men, it can signify something more serious that needs more detailed investigation than the pharmacy first service can offer. So those sort of boundaries are put on things, not to limit, but rather to include as many people as possible, but make sure where it signifies something else that care is given by the most appropriate provider, you know, such as a general practitioner in those circumstances.
Brilliant.
Thank you.
So we're down to our last 3 minutes of our webinar. Is there any last words, Tunde? Is there anything else you just, you know, last nugget you would like patients to hear around that partnershiping, so that patients become much clearer about how this service can support them?
Yeah, I think the only thing I can mention, I think David and Lindsey mentioned that the 7 conditions, for example, they can actually come into the pharmacy as a walk-in. But what we are trying to promote more is that what we do locally, our surgery, when they do refer people, they will refer with the time. So again, I think it's just, you know, making sure that patients are speaking to their surgeries about, you know, the possibility of being referred to a pharmacy if it's appropriate, and just providing us with as much information that they can at the time. So yeah, I think it's just about telling people to just try and support their local pharmacists and just be able to access the clinical skills that we are always willing to try and utilize.
Brilliant, thank you. And Lindsey, do you want to say anything before we go?
No, I think just to remind people, this is a new service, so we can shape it how best we need to, and it involves local communication. So, you know, everybody kind of listening out there on the webinar, if you haven't got the traction, you don't know that much about the service, this is very much about linking local community pharmacy with local practices. And if you can help facilitate that, even better. So, you know, invite the pharmacist to your local patient forums, let the pharmacist come and speak about the service, and importantly, encourage the GP practice to decide a kind of local protocol as to how best they want to refer patients. I mean, that's the reason why I was having 2 practice meetings yesterday, was just to agree locally, what's the best way if we do decide a patient needs to be referred back? Do we send the patient back, or do we communicate on email via the surgery? If so, which email? So it's all these little details that you need locally to make it a success. So bear with us, we are learning, we are doing the best we can, but with your support, I'm sure we can make it even better.
I'm glad to hear that call for patient partnership, Lindsey, in the design of services. That's, you know, that's what we're about. Pallavi, you're back on screen.
Yeah, fingers crossed it stays. I just wanted to come in and say thank you. There's lots of questions that we still haven't managed to get to, but we'd like to take those away and then provide you with some answers so that you can come back on your website and people have got that as well.
That's great. And David, anything from you? And then I'm going to come to Leighton quickly.
Rachel, thank you. No, really, I just wanted to say thank you for hosting today's event. Thank you to everybody who's joined. Really great questions. And I think as both Lindsey and Tunde said, that every time somebody asks a question, it kind of moves forward the thinking and the design and where we go in the future with all of this. And that's hugely helpful. I did also want to say a sort of thank you to all the community pharmacy colleagues out there who have worked so hard to get this up and running and are delivering it for their patients and their communities. I think it's a really positive step, and everything that everybody said about partnership with general practice is so important too. This is about all working together in primary care.
Fantastic. And Leighton, as our patient rep, you get the last word.
Okay, well, thank you very much. Yes, yeah. Well, I guess again, I'd just like to echo that and thank everybody for taking part and giving such useful and informative session, particularly from the pharmacists, and to get some of the questions that I had in my own mind straightened out in this session. And as David just said, you know, this is a partnership with the GP practices, with the patients, with the pharmacists, with the whole community. And if we can get the message out there that this service is available not just for these 7 conditions, but pharmacists can help with lots of other advice and minor health conditions too, which I know some people know, but lots of people don't think about it as their first port of call. If we can re-educate people into using their community pharmacies, who, as we said, highly trained and experienced in dealing with the public, then we're only going to make things better, and we're only going to improve access in the other areas of the health service.
Well, what a wonderful way to end. Thank you all very much. I really enjoyed. I've learned lots this morning. You're right, Pallavi. There's a lot of questions. There's a lot of questions around funding. I didn't feel today was about, patient knowing what the service does for them, but it would be good if we could address those questions as well. Thank you so much. Have a good day, everybody.
Thank you.